All right, today is an episode that's very important because we're going to talk about the number one cause of death in the United States, which is heart disease and heart attack and associated things. And we're going to talk about the connection that environment has to that a lot of times isn't really connected. And we've got a really awesome person on today that's going to help us talk through that. We've got Dr. Jung Kim on here, and I met Dr. Kim at a conference a few months ago in Texas, and we were chatting, and he told me his story, and my mind was like completely blown away. Uh, Not only his story, but what he does for people and how he does it. I was like, we have to do this. We have to talk. So I'm really excited to have Dr. Kim on. He's a functional medicine practitioner. He is the owner of Kim Wellness, which is a practice and informational source that allows people to not only like heal from environmental toxicity, but also to help kind of set the stage for them to thrive afterwards, which I think is a really, really important piece of this entire equation. It's not just how do I heal, how do I detox in the short term? It's how do I set myself up for success, for resiliency, so in the future, I don't get these, severe reactions that occur, and you kind of like rebuild your foundation. You can live like a good life afterwards. So I'm really excited for where this conversation is going. Dr. Kim, what's up, man?
Brian, thank you so much for the invite. I mean, I cannot believe it's already been 2 months
I know.
passing, right? It's time just flying, and then now it's almost the end of the year.
Yeah, it went really quick. And yeah, God, it's like almost Thanksgiving already. So
I know. It's scary. It's very scary.
So let's start at the top, because I think what really stood out to me was when we just started talking. When you meet people at things, it's like, oh, hey, who are you? What do you do? You just kind of start kind of shooting it and realizing like not just like what someone does, but why they do it. And I think that's like the really big thing. And I've always found that people who have like a strong why and a reason that they got into something are generally people that are more successful in that thing or have a bigger impact in that thing. So I would love to just start, if you could share just your high level, like your story that we talked about and what's driven you to where you are. I think that would be amazing.
Yeah, absolutely. So basically, the top point overview of why I'm doing what I'm doing at this point in time. So my name is Dr. John Kim. I'm a functional medicine pharmacist and a practitioner. I graduated with a doctor in pharmacy degree back in 2006, and afterwards I did a 2-year fellowship in functional medicine. And I am so passionate about functional medicine to begin with, and that's why I did it. But thing is, though, when I was just helping clients dealing with general things like gut, hormone, and that's generally things that I focused on, one thing I soon realized that there was always a plateau that person actually hits in their health and cannot seem to get to the issue. And I didn't quite understand how that's all related to possibly mold issues, person nervous system dysregulation. Maybe they're dealing with other ends of the spectrum and the nutritional depletion and all that. So what happened for me, and it's a humbling story that I like to tell, is that back in 2015, I actually had a heart attack, and STEMI to be exact. I had an 85% blockage on my LAD, or the Widowmaker. So
And
usually
how and how old were you at this time?
I was 33 at that point in time.
This is the thing that blew me completely out of the water when you told me. I mean, you're not old now, obviously, but it was
I'm 44 now.
yeah,
but
unreal.
10 years, almost 10 years, past 10 years or 10 years ago, I mean, that was a critical part, having to question how did a person, I was fit, exercising, and not to a point in terms of 6 months prior to having a heart attack, my lipid panel was normal, right? My doctor looked at it. I go for an annual physical, and he says, everything's fine. Come back in a year. 6 months later, having severe chest pain, having to question whether this was a heartburn, because I always had a heartburn to begin with. And then that evening, had a pain shooting down to my left arm. And then instead of going to the ER like an idiot, I slept, woke up the following day, still having this pain, then decided to go to the hospital, actually to the urgent care center, excuse me. And then they're like, you're having a heart attack. We have to get you to the hospital.
Wow.
So even when I was at the ER physician and the cardiologist didn't even believe that I was dealing with a heart attack to begin with. They're like, you're too young. I think you're dealing with pericarditis. But when they did an echocardiogram, my lower ventricle was not pumping well, which is a sign of ischemia. That's when they said, oh, shoot, we got to bring you to the cath lab. And after getting scanned on, they found out that I had an 85% blockage. So they had no choice but to put a stent put in. That was me. I was 33 years old.
So I have just like a question about that. So you ran like a standard lipid panel. Is there another test that could have been run that would have shown this? I'm just curious.
Yeah, absolutely. There's a Boston Heart diagnostic you could definitely do to see the levels of ApoB and other inflammatory markers as well. Those I look back and those were not run during that time. They didn't run any other inflammatory markers like MMP9 and other things that I usually end up having to look at to see if the person is dealing with chronic inflammatory response issues, right,
Mm-hmm.
SIRS. But this is a conventional practice that a lot of doctors go through. I mean, for me, if I didn't know what I'm doing now, I would have never questioned to even look at those numbers,
Yeah.
right? So this is the general how medicine's practice. We're just looking at numbers, right? Nothing in terms of asking the right questions. I had a lot of red flags to begin with. I had food sensitivity problem, high histamine, anxiety, horrible bad breath, acne everywhere. So looking back, I knew there was something going on inside, but I didn't know what was happening. And I was just busy putting out fires in my life. I just started open up a holistic pharmacy practice on top of just being busy as a business owner. You're moving around, living life, enjoying life. And then all of a sudden this actually happens. And then you get to wonder, how did this happen to begin with?
Well, so that's the next question. So that's where I want to go. So how obviously I can imagine you're like, I'm 33. What the hell just happened here? Right. And you being the smart guy that you are. So how did you dig into it?
Yeah.
What conclusion did you come to?
I don't think I'm a smart guy at all. I just end up having to have the right people around me to ask the right questions. And that really became a learning point for me to start from there. So after having a stent put in, sitting in the ER for 3 days, then getting home for a week and just staring at a wall and then wondering, am I going to have a secondary heart attack? Just because you're on statins does not mean, and they put me on statin, they put me on Plavix as well. And
Mm-hmm.
then they also over medicated me to a point that I fainted once.
Wow.
So there's a lot of issues already happening, but I knew for a fact that secondary heart attack can actually occur, especially being that I'm young, is inevitable. So I decided to look into further in terms of, what could potentially cause this issue. So all I wanted to do was get my energy back because I was so fatigued. Went to my doctor, who's an integrative physician. She looked at me. She's like, I think you're dealing with some kind of infection. You really have to look at this. I'm like, there's no way. So after blood being drawn, it took about a month and a half later. That's when we found out that I had positive infection for Bartonella, which is a cat scratch fever from potentially a tick bite,
Yep.
high antibody levels of Aspergillus,
Okay.
and then on top of Mycoplasma pneumoniae, parasites, heavy metals, right? So these are the true issue that was already hidden. And
Mm-hmm.
then the heart attack issue, especially when you have an atherosclerotic plaque being built, that's basically the aftermath of what's happening there.
Yeah. So functional medicine look at what was going on shows that there was kind of a lot of precursors to this occurring, right? You just
Mhm.
described heavy metals, parasites, mold issues. You have Bartonella, which is tied to like, potentially Lyme associated and tick-borne. So as you were digging through this, I know that we spoke and you were talking about mold and mycotoxins specifically and your opinion on like the amount of impact that that had on everything together and how that kind of shaped how you look at things now. Would love to just kind of like talk through that a little bit now that you've been through it, you've researched, you obviously have your pride, which we'll talk about later, how you work with people. So how do you view that in the scheme of everything?
So just specifically talking about my case, there's two issues at this point. So number one, you have Bartonella infection, which actually causes endothelial damage. So basically, the lining of your blood vessel gets damaged at that point in time,
Mm-hmm.
right? And then when you're actually adding in things like mycotoxins, for instance, the mold in itself, as all listeners that are listening know that mycotoxin being produced. And these are basically a secondary metabolite that triggers systemic inflammation. And that inflammatory condition end up having to damage further the endothelial lining, impairing nitric oxide production and promoting more vasoconstriction and arterial stiffening. So this is basically the beginning stage of what's happening at that point in time. And this process, the endothelial dysfunction that person is dealing with, is just a foundational step that leads into atherosclerotic plaque buildup. It also turns on the high risk of heart disease, arrhythmia as well. Some people, it can also lead into myocardial infarction, which I had. And the thing that I like to focus on people when I'm talking about all these things is that, yes, there's a big play of mold and lipids. It's just that in my language, in my world, I talk about the cellular terrain being compromised. And
Mm-hmm.
that in itself causes the loosening of the cellular resiliency. So you have blood vessels, especially made of phospholipids and cell membrane, that gets affected, which are becoming more prone to stress and damages when additional insults that come in, such as toxins like heavy metals. EMF, toxicity is a big one that I talk about often these days, right? And then you actually having other things like volatile gases and such, and just leading into much higher levels of that. So it basically accelerates. You think about a turbo boost in your car, right? You want to get to from point A to point B. You could drive a hoopty, or you could put a turbo in your fast car and just go even faster. And this is
Mm-hmm.
exactly what these type of toxins end up having to cause, causing a cellular terrain damage within that. And when you're talking even deeper in the quantum biology aspect of it and circadian biology, is that when you're affecting changes cellularly, it also changes the structural water component within the mitochondria as well. So especially when you talk about sunlight hitting your eyes, end up having to trigger multiple other metabolic process, your mitochondria gets affected from the sun to create water in your cells as well. And that water itself called the structured water. That structured water actually helps to increase blood flow as well in the body. So there are studies like Dr. Jared Pollack, for instance, saw that the red light end up having to create the movement of red blood cells moving forward, right? Without heart pumping. So it's just not, but the heart itself now is affecting the overall flow of energy that's happening. And that's what the effect of the cellular terrain that actually happens because of mold and because of toxins. And when you have a stagnancy, the stressors and such, and then on top of the endothelial damage now
Mm-hmm.
just adding on more of the problem in itself, leading into the condition I had when I was 33 years old.
Yeah, it's really interesting. So something I just pulled from what you said, because I was thinking about this as we were coming into it, and I was looking, heart disease, heart attacks, like the prevalence of that, uh, in the US, obviously I knew it was a big thing. It's the number one cause of death in the US annually is heart disease, which can accompany a lot or could encompass a lot of different things. And I think the way that you described it is actually really interesting because it's not just your heart specifically, which is what you were just saying, is what I was hearing. Like your heart pumping and how your heart is functioning is one piece of it, but it's all the rest of the roadways, the vessels, the veins, like all of that stuff. And those get impacted and they're not necessarily part of your heart's function. They're part of like the road that moves everything around in your body. And in my mind, when I separated the two, I was like, okay, so heart disease isn't necessarily just the heart itself. Heart disease is everything that's attached to it. And they lump it together under this phrase. And in my mind, what happened for me, I was like, oh, I feel like that there's just a broad misunderstanding of what heart disease actually is. People think, oh, it's heart specific, it's whatever it is, heart attack, it's this, that, or the other. But it's like there's all these things that are not, quote, the heart that are contributing to something that gets rolled up into heart disease, right? When we talk about it. And, I had recently started looking into some of this stuff too, because I just did the function health blood panels on myself and saw that I have high ApoB and I have high LDL and my particle size of LDL is small. And so like these things, I'm like, oh man, I'm like at risk here for something that's going on. Plus I have one ApoE4 variant as well.
Mm.
And I'm like, okay. I need to like really dig into this and try to figure out like how I'm going to get here. Seems that I'm relatively early on and that I can do some adjustments in diet and just kind of things that will help, kind of counteract that step, right? But this is what's so interesting about it. It's why I kind of asked, like, well, what blood panels could you have run to get ahead of this thing, right? Like I almost like picture myself kind of like what happened, with your story, just maybe a little older in age. And it's like, oh, this happened, but there were all these things going on that could have like let you know that this was happening, right? And the environmental impact, obviously there's genetics and other things, but what you're talking about how the environmental impact triggers inflammatory responses, how it affects the endothelial lining, which in my mind, the way that I saw it, I pictured like a road, and the endothelial lining was like the boundaries of the road. It was like the sidewalk basically on the street, right? And then the blood moving through, the cholesterol, that was like the cars that were moving. And then ApoB was how many cars are moving on that road, was kind of how I was imagining it. And so I had this big long talk with ChatGPT about this, which is hilarious. You can tell me how on this analogy is. It basically was saying there's like a couple things going on. It's like you have the endothelial lining. If it is smooth and not damaged, then the cars, if they hit it, they'll bounce off of it and they'll like kind of slide off of it and keep moving, which won't cause a pileup of the cars because the cars will keep moving. If it's damaged, those cars hit the endothelial lining, and because it's not smooth anymore, it's like, stickier, let's say, the car gets stuck. And so then you start building a pileup, right? And so then it became a formula in my mind of two things. You need the endothelial lining to be healthy, so you're not allowing things to get sticky and stick to it, these cars that are driving by. And you need less cars that have the ability to stick to it, right? So it's the outside of the car. In my mind, it was almost like Velcro. It was like, if you have the two opposite pieces of Velcro and they come together, they stick. If you have the same piece of Velcro that comes together, they move. And it was like, what I need to do is line my outside of my cars in the same healthy Velcro that is on the inside of the street. And if they bounce, they're not going to get stuck. And so then that was kind of how I thought through this whole thing, of how you attack like those different areas, and focusing on what really to me seems like the precursor to heart disease and heart attacks, which is how smoothly and effectively are things moving through, and are you causing these pileups and these holdups? Am I anywhere close in this analogy?
You're definitely close. I mean, that's really hitting on a nail of the head. There's a chiropractor. His name is Dr. Stephen Hussey, Hussey. He actually had a heart attack age of 34, and he actually had written a book. He actually has a history of type 1 diabetes, and obviously with that condition, your risk factor for cardiovascular issues goes up. But for him as well, same thing, same issue. And so he came out in terms of his overall booklet about understanding the heart disease, and people could buy that and read into it even further. In terms of what I'm talking about right now is very similar to that discussion. It's really fun. I didn't read that book, but after learning more about the cell membrane and as well as how that affects in terms of sunlight and affecting structural water changes within the cells, the structural water actually produces negative ion, right, charges. And that in itself propels the water to dispel. So in terms of what you are mentioning about, it propels movement. That's exactly what's happening. And then when you have an intensity of the infrared light from red light panels, and as well as something that you get for free, sunlight, is so powerful ways in terms of affecting positive changes in that flow. Right? That also affects changes in the mitochondrial function, as well as the inflammation that you're dealing with, and making positive impact on the immune system as well. And sunlight is also antimicrobial. So it also helps to affect positive changes within the mold issue that people go into. I'm not saying that it's going to get rid of everything, but it is one of the components that I put into my Encore program when I work with clients.
Can you explain the sunlight as antimicrobial a bit more?
Sure. So in a sense that when you are getting sunlight exposure, that in itself produces superoxide. And that in itself acts as an antimicrobial for different things in terms of antibacterial, antiviral, and
Mhm.
mold in itself. So we already have a built process to process that. I also helps to empower our immune cells as well. Each of the immune cells actually has receptors to getting positive effects from infrared. So this is the part where T killer cells are needing sunlight to do so, right? So it is a good idea to get out in the sun when you are sick, right? So for
Mhm.
instance, back in the 1900s, hospitals actually had special rooms designated for sunlight. So you basically going out in a courtyard and have several beds. You could probably find a picture of this, but that was a normal part of it. Another thing,
Mhm.
another history, a fascinating fact. I don't know if you know Dr. John Kellogg. He's the founder of the Kellogg cereal company.
I've heard of him, yeah.
Right. So there was a whole conspiracy about how he formulated the cornflakes to decrease testosterone level in boys because he wanted to prevent boys from um, masturbation. That's basically what it was.
I've
But
heard this too,
yeah,
yeah.
so it's a story, right? So, but the thing is, one thing
Yeah.
that he has that you could find his book on sunlight therapy, very thick textbook, just on the use of sunlight to making positive changes in our health. And he actually talks about mold in that book too,
Huh.
including lime sparkies. So there are studies and showing these things in terms of how sunlight, especially infrared, making positive changes cellularly and in terms of structuring water, as well as creating antimicrobial and increasing cytokine activity to clear things out, including the fact that it helps to increase autophagy as well. So you're trying to clear out dead cells, clearing it out and helping to create newer cells. So we actually have this method to do so. The issue nowadays is that our system is bombarded with blue light toxicity because of the LED, right? Cell phones, for especially, we're bombarded at this point in time. And when you're getting exposed to different types of blue light toxicity, what it does is um, it affects how you end up having to detox. And I'll explain how that occurs. Mitochondria don't just make energy, it actually tells time. And there's a particular thing called the supercosmic nuclei, the body's master clock. It
Mhm.
synchronizes with every cellular process, including detoxification. So through light exposure, sunlight, that could actually help with further effect in terms of the methionine pathway and goes right into the methylation process that everybody talks about, right? Methylation is very important for detox. However, when you're getting exposed to excess blue light toxicity at night, it desynchronizes the process of the mitochondrial function, altering melatonin production, and it impairs autophagy and the cellular cleanup that you're looking for. So when your circadian rhythm is completely off and broken down, your detox pathway breaks down slowly and inflammation actually rises, and then your cells loses resiliency. So in this state, mold toxin especially doesn't just challenge you, it actually overwhelms you. So that's why light hygiene is something that I critically help my clients to get back in order for them to get the permanent fix they're looking for from mold toxicity issues.
Yeah, it makes a lot of sense. And like when I think about, because you mentioned EMF, you mentioned some of these other things. There's a lot of things, obviously, right? And I try to think about like if I had to pick one, which one do I think is more what's the word I'm looking for? I'm gonna say impactful because that's not the right word, but like there's more volume of it. Like it's just like more prevalent,
Yeah.
than others. Obviously, EMF is something that is everywhere, right? So I think that's something. The other thing is air. And that's the other thing is like you breathe 20,000 times a day. If you have these issues that are going on, it is constant exposure, repetitive. Food you eat a few times a day, water, obviously you want to eat healthy and drink, right? But those only impact one direct body system immediately. They go straight to your gut, and that's where they go. When you breathe, it's your lungs, it's your gut through postnasal drip that's seeding straight into your gut, and it's directly on your skin. So the air that's around us has three direct body pathways that it touches, as opposed to one that then has a downstream effect. And so, EMF is going to, get to us internally at more of a cellular level, and that's going to impact too. But it feels like to me like those eating healthy and drinking clean water, those are things that I think people talk a lot about. And obviously, your diet's got to be good, so you're not putting things that are in there, right? And I think that's almost like more of a given
Just
than
given.
than not, right?
Yeah.
But it's like, what are the other things that we're not aware of that are still having such a profound impact on these numbers that we're seeing and how many people die every year from heart disease, right? And obviously food's a piece of it, and the US diet is very poor compared to others. And so I completely get that. But like with a number as high as this, 22% of the US, it goes, so there's the top three is heart disease at 22%. It's I just wrote it down. It's cancer at 20,
Mhm.
and then it's unintentional injuries at 7. That's the drop off. 22%, 20%, then 7%, and then whatever else falls under 7%. And you mentioned it a minute ago when you start talking, you were talking about autophagy, you're talking about cellular function, you're talking about clearing out of bad cells and all that stuff. That's cancer. That's where that starts. You add those two things together of the cellular inefficiencies, the need to optimize cellular function, the impact, the negative impact on cellular systems that comes from environmental, and you're talking 40% of annual US mortality is at least attributed to these things. And like we start asking our questions like, why are there so many people, more people dying of X, Y, or Z now than there were before? And you start looking at like how the world is changing and the environment is changing, what's going into our bodies is changing as what was happening before. And for me, that's the change. It's like our bodies are the same. We're eating worse. We're breathing way worse from how we build houses and what's going on in homes. And we have way more EMF and electromagnetic stuff that's coming in. Like it's
Correct.
external trigger that's causing all of this stuff. It's not some weird internal change, in my opinion, that's happened. It's we're giving our bodies, which you mentioned earlier, they're meant to detox. You said, it's like that they have these processes in place. We're overloading and they can't keep up.
Yep.
And so then it's talking about like what you do with people, which is like, okay, how do we build new kind of clean slate? But then how do we create this internal terrain that can now kind of withstand some of this stuff and can combat it a little bit better without just like constantly being beat down?
Absolutely. It affects cellular level at such a high level as of it. I mean, especially the things that I look at when I work with clients dealing with mold toxicity, it is an important factor to looking at the lipid panel. And here's the reason. The reason being is if you're looking at the lipid panel, finding that there are abnormal cholesterol level, for instance, higher levels of total cholesterol, high LDL, right? Those constitute bad cholesterol. But the thing is, though, that really shows the fact that there is a mycotoxin interference can actually occur as well, right? So
Well,
mold toxins, especially, can actually increase some of the key enzymes to increase cholesterol biosynthesis.
Oh,
That affects the bile acid synthesis as well. So it actually has a trouble clearing out cholesterol. So this is a problem. And then on top of the lipid transport system gets affected due to mold and mycotoxins. And then when you're adding on oxidative stress and lipid peroxidation, mold toxins generate reactive oxygen species and then end up having to reduce antioxidant capacity as well. So obviously glutathione is something that is going to be depleted. And then this can also oxidize lipids. So that's why your ApoB level can be increased from that. But that could also means that there's a underlying mitochondrial dysfunction that's happening. So I actually look into much deeper issues, how that's all related to atherosclerotic plaque, how's that person's mitochondrial functioning happening? Is there any damages within the cell membrane? Because if you're looking at things like aflatoxins and trichothecenes, which we know that trichothecenes itself is really bad, trichothecene can also affect protein synthesis. But if you look at these things, the fact that aflatoxin and trichothecenes are lipophilic, they integrate into the damaged phospholipid membrane of your cell membrane itself, which can lead into DNA adduct. And then these cell membranes are very rich in things called a cardiolipin, which is a key component for the inner mitochondrial membrane. And once that gets affected, your electron transport chain, how you transport energy and all that, that gets completely in a disheveled shape, which can lead into your energy production being low, Hence, people become very fatigued, brain fog, neuroinflammation, immune system dysregulation. And then when you have a, a compromised detox pathway and not able to do proper cellular repair, now you're just basically trying to bail out water on a leaky boat,
Yeah.
right? You're not fixing anything. So this is
Yeah.
the part where I often have to teach my clients. Yes, you see so many influencers saying that you take the binders, you take the antifungals, but the underlying issue is that you have a cellular damage that goes on. If you don't fix that, you're not going to be able to be resilient to handle the overall environment that you're living in. Why are people still going through years of taking binders and being still reactive when they get exposed to mold again?
Yeah.
Right? You
Yeah.
don't fix the problem unless you fix the actual cellular stress issue that person's going through.
I want to touch on that a little bit more and dig into like how you look at that and how you know, some of the high level things that you do to teach people that. Quickly before we do that, I just want to go back to what you said a minute ago, that mycotoxins increase cholesterol synthesis. So can you dig into that just a little bit more? Like when you, because that, like that to me, when you said that, that's now we're talking about how mycotoxins are actually directly increasing the cholesterol component that then ties into heart disease, which then we know is a big component. That's like, it's just very interesting. I'd love to just kind of dig into that a little more.
Yeah. So think about cholesterol as like the fire brigade trying to put out fire, right? So if you have an underlying lipid peroxidase, basically your cell membrane getting damaged, and then there's several other sense of saying that there's a cytokine activity, the cholesterol getting produced to quench that issue. There's a reason why you have a high cholesterol. It's not because of the fact that you're statin deficient. And statins
Mm.
also is a mycotoxin, and people don't know that.
Wait, what? Statins are mycotoxins?
Yeah, statin drugs are coming from red yeast rice. That's a mycotoxin.
Wow.
That I'll give you a perfect example. Several other drugs out there are mycotoxin derived as well. There's a product called mycophenolate, stems from mycophenolic acid.
Wow.
Cyclosporin, that's another mycotoxin as well. What are those? Those are immunosuppression drugs to prevent your organs getting rejected if you get a organ transplant. So it
Yep.
is created perfectly to handle that. But when you're getting exposure of those things, environmentally, what's happening? Your immune system gets affected. Why are you constantly getting these Epstein-Barr issues and viral problems on top of dealing with long COVID issues? COVID just blew up the entire bucket of the issues that you're already dealing with. What's the underlying problem? Mycotoxins. And your cellular resiliency is piss poor. Right? This is the part that I teach my clients. Like, you have a problem, you have symptoms, but there's a reason why you had those symptoms, because your underlying cellular resiliency is piss poor due to mycotoxins, EMF, blue light toxicity, your epigenetic issues, crap, right? Your mitochondrial DNA damage as well. And you're basically digging yourself into a hole bigger and bigger when you're trying to take different supplements, because those supplements, if you don't curate it well, is also depleting your nutrients that you really need. Taking binders, for instance, for endless amount of time, it's going to affect your minerals as well. What do you need minerals for? To create, to really help your electron transport chain to function well, right? You need magnesium, you need calcium. When those things are getting depleted, that's going to affect cellular changes. And then you end up having to talk about DNA antidote, where mycotoxins end up having to bind to the DNA. It actually changes the epigenetic expression of that particular DNA. Now you actually have a protein synthesis gone wrong, can lead into autoimmune disease and other disease states. So mycotoxins, not just a simple issue, like you got to get rid of it. No, it is changing you cellularly, that you need to fix this problem. If not, you're just going to go right into square one and wondering why you're getting stuck and being sick constantly.
So mycotoxins come down to be like the root of many of the downstream things. And so then it's a combination of address the mycotoxin mold piece and then along with that start rebuilding the damage that was created up until that time.
Correct. So you need to really get to the cellular level and reversing those damages there. So this is where therapies like lipid replacement therapy that comprised of different types of fats like butyric acid, phospholipids, alpha linoleic acid, special pro-resolver mediator types of DHA and EPA, right? Along with TUDCA, which is secondary bile salt to actually help to prevent mitochondrial stressors. All those play into effect to really making positive changes within the cellular health. And then you could actually help to ease the actual stress response in the cells, allowing the mitochondria to kick in better and then doing its own thing. Then you could add in different types of antifungals, binders, and such. But when your underlying foundation of cellular health is impacted, you can't detox mold. And this is the part that I often see with clients. And once we get to that level, they could usually end up having to get rid of the mold issue within 4 to 5 months, not years.
Interesting. So your order of events is effectively some form of, in my mind, I'm thinking like a cellular reset in a way. And then going to the detox, is that kind of
correct? So my 6-step methodology is called the Encore Method. It stands for environmental optimization, nervous system reset, cellular function, optimizing detox pathway, rebalancing microbiome, enhancing resiliency, the Encore Method. So the environment has to be really tip-top shape. So obviously this is where your line comes in, testing, optimizing the overall environment, right? Looking in terms of the EMF exposure and blue light toxicity issues. The environment also has to be optimized so this way the person feels safe. Not just mycotoxins, you have to also look at the relationship aspect into the family structure as well. Right? I've seen women, and 90% of the clients that I work with are women. They've gone through heavy amounts of trauma issue from the past relationship or the current relationship, and it's affecting them mentally. So that goes right into the nervous system aspect of it. How do we calm your nervous system so this way you're not in a hyper-reflexive state? Because mold and mycotoxins causes something called a microglial priming and mast cell priming as well. So that's why when you're getting re-exposed to different mold, your nervous system already remembers that, hey, this is a threat. I got to get into fighting mode at this point in time. So why people getting reacted to mold, even there's a small exposure, that's the reason why. So you didn't fix the underlying nervous system dysregulation. So once we get to that dialed in, usually these people are able to get their symptoms under control. And then now we're working on the cellular health aspect. Food has to be the focal point from the beginning. It's not supplements, right? So I discussed about seasonal paleo-based diet, where you eat things seasonally based on where you are. So for instance, you're not going to be eating bananas middle of winter. Why? Mitochondrial wise, when you talk about those type of food, is very pro-inflammatory. First, the fact that it's going to raise your blood sugar, but that's another point. But you need to really focus on paleo-based diet because that's going to really help to decrease inflammation, getting any other offending food away, and then replacing the healthy fats. So phospholipids, I recommend Body About PC a lot. Their bioactive oil called balance oil, which contains omega-6, omega-3, help to rebuild that inner structure of the cell membrane. Butyric acid actually acts as a chemical chaperone to get rid of the mycotoxins away from the DNA. And then you actually have secondary bile salt, TUDCA, that actually helps to relieve the protein misfolding because of the mold, but also prevent extra stress on the mitochondria. So this is a part that I teach my clients early on, and then really getting into how do I optimize that detox pathway. Your gut function, your liver, your gallbladder, your skin, the way that you sweat, right? Even including your breath is a way for you to detox. And then rebalance the microbiome. Not saying to kill every mold possible. You need some Saccharomyces. Those are healthy yeast that you need in your system. And then adding to rebalancing different types of offending issues. Or if you're dealing with co-infections, so those have to be addressed as well. But it's all about the balance. And then the last part is, how do we create enhancing resiliency in your body? So this way you are handling the overall stresses in your environment. right? You need to live, you need to thrive. And this is the part that I teach my clients, that you got to enjoy your life. You cannot
Yeah.
be living in fear and then wondering when I'm going to be attacked from mold again.
Yeah.
And that's something that I always have to address, that, hey, the reason that you're doing all this work is this way you could gain your freedom and you're not going to be reactive to the overall environment that you're living in.
I like that. I see that with people too, or even when like there are people who do big remediations in their house. We retest, like it's all good. Like we have everything that shows that like you're in a good spot. Like we said that, or maybe we were talking before, living in a zero mold environment's not realistic and not possible, but you definitely can live in an environment that is not like a big issue. That's, you're going to be exposed to little things, so that's just life. You just don't want all of it sourcing from inside your house, right? And so I've seen this multiple times. Whole house is remediated, post testing looks good, everything is great, and the person goes back in and they're like, I can't live here. It has nothing to do with the house. It has completely to do with the nervous system and their fight or flight response and all of that. And I've had many conversations with people along this line. I'm really glad that you brought that up, because the relationship thing is the interpersonal relationships, but it's also like the relationship with your space and like how safe you feel somewhere. So you feel safe with a person, you feel safe in a space, right? And when people come back into their space, and you said it, trauma, this is a traumatic experience, right? And so your body, every breath, I mean, literally every breath you're taking, it's like somebody's punching you in the face, right? Like this is a very traumatic experience that the body's going through. And there are just some people that when they get back in there, it doesn't matter how clean the place is. Like they can't do it, right?
They cannot do it.
And so there's times where I'll talk to people before they go down the road. You know, maybe it's a significant remediation that has to happen, and they're open to doing it. But I can tell that they're like a little skeptical that it might work or it might not work or something like that. And I'm like, listen, I think that you can remediate pretty much anything. I've seen terrible places come back, right? It's just it's a formula of time, inconvenience, and cost. I mean, that's ultimately what it is, but I think you can get pretty much anything back. That doesn't matter if in your mind, if you think that when your house is done and you lay your head down to go to sleep at night, are you going to feel okay saying, hey, we got it? Or are you in the back of your mind, are you going to be wondering if there's still something there? And if you're that other person that's going to always be wondering, did I get it all? Did I get it all? Is it going to come to get me? Did I get it all? It's like, you shouldn't do this in this house. You should find something else, because you're going to spend this money. And because the nervous system that's been primed, like you're talking about, you've trained your body to respond to things like this. It's not going to work the way that you want it to. And I think it's like such a big part of this that gets overlooked all the time, is that stress response and the impact that it has on just how your body functions.
Yeah, that's why I created that method, because I often saw people, they're going through several years of mold journey and everything's re-triggering them. I'm just like, what's happening right now? And then having to work with severe mast cell clients, that's where you really learn that environment, nervous system matters first, and allowing that person to feel safe, then you could do all the things, right? And that's the mental part that practitioners cannot understand. It's not the fact that they're not qualified to do so, but unless you're really able to experience what I had to go through in my own health journey,
Yeah.
and walking that walk and being connected with that client, is so hard to relay that.
Yeah. What do you do for that specific, like when you're working with people? That's a mindset thing, right? So like, how do you work on that?
So that's a part that requires sometimes not just me, but working with a therapist as well, right? So that's a behavioral modification you got to have to do. So that's
Yeah.
something that I could do. So one thing that I teach my clients is something called the heart coherent breathing technique. So there's a company called HeartMath. You could buy a particular sensor to see the real coherency and heart rate variability, to see how much of a stressor response you're dealing with. And there's a part that's really going to lock in terms of controlling the symptoms. I've had clients where I'll give you a perfect example. I had a client who actually had resting heart rate around 90, and
Wow.
she had traumatic issues. Like, she lost her child. Like, her child ended up having to fall off a boat, and she saw her child dying.
Oh my
And
God.
she ended up having to experience this issue and how that guilt for 18 years and having to have this high cortisol, high stress response. Once we implement that nervous system reset program that I had implemented for her, within 2 months, her resting heart rate was down to 60. Changed person, less reactive to everything, not
Wow.
inflamed. It's not just about supplements right now, right? We're
Hmm.
talking about nervous system regulation, allowing the body to feel safe. Then everything starts to shift into a positive ways to getting the body back in order. So that's the reason why I'm a strong believer that as long as you give the right tools, the body heals itself. And I experienced it on my own, experienced it with several of my clients as well. So, you need to have a team. You need to have a somatic specialist, if not EMDR specialist, right? A cognitive behavioral therapist is another thing that I sometimes recommend. And then the mental component is that you need to allow yourself to self-regulate. You have
Yeah.
the tools, but if you keep on relying on this, you don't know how to self-regulate. So this is a part that I teach.
Something you just said, like, just made me think of a correlation or like an analogy or something. But like a lot of the reason that, call it Western medicine, call it your primary care doctor, call it the medical system, whatever. A lot of the reason that people have started like understanding that we have to go more towards functional health and that sort of thing is because it's you walk in the door, you're prescribed a pill. The pill's supposed to fix everything, but you don't fix the root cause. And that's where root cause comes from, right? And then what you just said about supplements, I feel like supplements, because of social media and because of our ability to see what everyone's doing I feel like supplements have turned into the new prescription drug that just fixes your problem.
Absolutely.
Yeah, it's crazy that just sort of like clicked for me, but it's like everybody's like, oh, this supplement, this, and then they're supposed to do functional things. But normal human nature is I want something. The whole reason that people buy into the shortcut solutions is because it's easy.
It is
Like the easy things are what we all want to do. We all want results and we don't want to have to work to get them. That's literally human nature. Like we all want the same thing. I want to be ripped and I don't want to work out. How do I do that? Oh, we created the Abtronic. Do you remember the Abtronic back in the day? Do you remember this? Okay, so
the
anyway, I don't
pulse.
know why
Oh,
this is
that's
all just
funny.
like flooding to me right now. So I had my roommate in college.
Did you buy one too?
No, I did. My roommate in college was a big, heavy guy,
Yeah.
and he saw the Abtronic ad, which for those of you who aren't familiar, is basically just like this pad that you sort of attach to your abs, and it has electro pulses of some kind, and it's supposed to work out your abs. It's working out your abs without working out, and the sales pitch was you're going to get abs by sitting on the couch doing nothing. I can't even imagine how many of those things that people sold, right? Because it's literally what everyone wanted with zero work and zero change, right? Like that's like
Yeah.
normal human nature. Side note on that, we used to take the Abtronic and then we would have competitions of who could turn it up the highest and
Oh
handle it
God.
with like terrible college kids. Um,
Oh, it's
but the
funny.
supplement thing, I feel like has really kind of turned into that. It's like
Yeah.
I've heard of TEDCA, I've heard of PC, like we've heard of all of these things. And it's one thing to say, hey, we know that PC is a great lipid thing. And we know that, we know that these things sort of work. And it says like, well, let me just take this because it's gonna work. And it doesn't necessarily work that way, right? And it's not as easy as I'm just gonna take this supplement if I'm not set up in a place to do it. I don't know. I went off on a tangent, but for
No,
whatever
no, that
that's
you're
like for
absolutely correct on that. And that's the reason why I was on a podcast recently with my friend Courtney Swan, and I said the current state of functional medicine is completely broken. Why? Because we still end up having to go back to the allopathic model of just recommending everything possible without really having the clear roadmap and a strategy to get the patient from one to the other. And
yeah.
one thing that I tell my clients, and I say it out of love, at some point, I don't want to ever see you again.
Yep.
You got to be done. You got to be seriously done. You cannot be doing mold detox for years. I've had a client, actually had one lady DM me on Instagram because I was keep on having to do these Q&As this week. She's like, yeah, I've been suffering from mold for 5 years. I'm like, 5 years? I'm like, how long are you planning on doing this for? You got to be done. It's not normal for you to be taking binders for 5 years.
You know what's interesting about the normal thing, and I think this has happened. I think this is why people like that are around and talking. the idea of like there's like this label of mold illness now, and it's become normalized. And it's like, oh, if I have mold illness, I am gonna be sick for years because that's what happens. And when something gets normalized, like, oh, it happens all the time, so this must be normal, people just start like accepting that. But that's not true. Like there's so many areas in life where things happen frequently and it doesn't mean they're okay, right? Insert school shootings. The way that we would have reacted to that 50, 60 years ago to the way we react to it now is like, oh, there was another one over here. That sucks. And then you just kind of move on. Like it is insane because it's happened more frequently. And so we've been desensitized to it in a
Yes.
way, and we begin to just accept it. And that has happened with environmental illness, mold illness too, in my opinion, is that, you know, there's good and bad of having social media groups and places where people could go and communicate with each other. The problem is when you have people in those rooms that don't know what they're talking about, and then you just see a whole bunch of people that are kind of struggling the same, and then everyone gets mass group just sort of thought, which is like, well, this is what happens. You just struggle forever like this. And it becomes their identity instead of something that I can get out of this. Like, why am I letting myself stay here? This isn't who I am, right? It's tough, man. It's
It's
tough for
tough.
people.
It's tough.
Yeah.
It's like I'm saying this out of love, and I respect them a lot. The shoemaker protocol,
Hmm.
right? People label themselves as like the shoemaker protocol guru here and there, and then you actually have the minions, the patients, going around and saying that, I follow shoemaker protocol. I have a HLA genotype issues. I have this and this and that. I'm taking cholestyramine. That becomes their self identity.
Yep.
And then thinking that if I don't take X, Y, and Z that Dr. Shoemaker is telling you, mind you, he's a pioneer in this space.
He is
But what
100.
I'm telling you right now is that he pioneered it, but I'm showing you the roadmap to get out of it,
Hmm.
right? So this is a part that's often missed, that you don't have to keep on having to rely on a supplement. As long as you have the right tools and the roadmap, you get out of it, and then you live your life. And
Yeah.
this is the part that I also taught one of my clients. She was done in 5 months. She had severe POTS issue,
Wow.
and after clearing the mold and the nervous system regulation, after 5 months, we got her mold toxin testing back, completely cleared. And I just told her, I'm like, okay, you're done. And she's like, what do you mean I'm done? I'm like, you're finished. Stop taking your supplements. Live your life. Go eat.
Yeah.
I mean, she's a person who was complaining that, oh my God, this program's so long. I'm like, well, your wish is that you're done. And then she just gets worried about it. Why? Because again, is the part that's taking supplements becomes a trauma.
Yeah. Yeah. What if I don't take this? This helped me heal. What if I stop taking it? Am I going to get
Exactly.
sick again? There's a lot of mental stuff around it, but I love your approach to this, which is, yes, we got to fix the problem. If you have toxicity issues, we got to fix, we get it, right? Like mold is not good. But how do we get you past that? Right? Like, how do we get you to the point where you can go out and live your life and be fine and not be worried and scared and concerned all the time? And that's the lifespan part of lifespan, health span, right? Like lifespan is like, let me go out and just be healthy and enjoy myself and be aware of like what's going on, obviously, and check in on it. But that part of it is really, really cool. Um, so you work with people directly. You also have other ways to work with people. How do you work?
Yeah. So usually I do one-on-one coaching with clients. It's a more of a concierge practice where when patients end up having to come with me, we go through the lab, the past medical histories and such. I program a customized protocol based on the Encore method, as I mentioned before.
Hmm.
And usually that takes about, 5 to 6 month process. So that's more hands-on, to a point I actually give them my direct access of my cell phone. So and I'm very selective into who I work with, because
Yeah.
unless you're really ready to take this journey, it's very difficult for you to do,
Yeah.
right? If you are in a very dysfunctional nervous system response state, you can't work through a program like this. You got to go back and then work on your other things. This is something that I teach my clients. And then now I'm going to be relaunching my mold course very soon as well. And a group coaching is going to be opened up very soon. So what I'll do is, for your listeners, I'm actually building up a special landing page for you so that
Cool.
people could visit and then sign up for these programs that's coming up. And some people obviously they cannot afford to do X, Y, and Z. So if the group coaching aspect of it works well, I'm going to give you a lot of value and work in that. And all I want to do right now is just have you get out of this moldy mess. Because I've been there. I know how painful it is. I mean, when I was going through my own mold journey and I was doing IV phosphocholine, which is basically IV
PC.
form of a lipid therapy.
Hmm.
I mean, I spent up to $30,000. It sucked. I wiped out my savings, and having to wonder, how am I going to make the money back? I cannot even work very well because I'm sick constantly. I've been there. I know how it is, and I don't want people to go through what I had to go through. And
Yeah.
now, being that's really hyper focused into these particular roadmap I do, if you could follow well and really get into having the determination and change and discipline, you'll be done within 5 to 6 months usually. And I've seen that for people.
It's crazy when you
Yeah,
hear the years that people go through this process,
yeah,
to be able to have the opportunity to do it in a way that is it's honestly just more efficient, like a more efficient way of doing it.
it is. And you
It's
need to have
great.
a right environment. And like I said, people need to hire the right mold testing company, right mediation company also. And I've
Yep.
seen some bad testers.
Yeah.
I'm just like, how can you be in business? Like, like, what are you doing? So this is a part that people need to understand, that remediation process, they cannot skimp on it. You need to find the right people, right? Including testing wise, right? Um, and then even to a point of the hiring a building biologist to come in and then figuring out if you have dirty electricity in the house, volatile gases and such. So this way, house becomes a sanctuary for you to rest.
Hmm.
That's the important part for all healing there. Supplements is very minimal when you have a dysfunctional environment.
I think that's a great place to call it. This has been a really awesome conversation. Thanks for taking the time.
I appreciate this invitation, and I was, hopefully I've add a lot of value to the listeners today, and really thinking about that. You don't have to suffer alone. I mean, there's definitely a roadmap for you to get out of this mess.
Absolutely. Well, we'll get your link that you mentioned, that we'll share in show notes. Your general site is kimwellness.co. It's KIM
Yes,
wellness.co. So people can go check that out. We'll put the special that you offer down in the show notes. So that'll be there for folks. And thank you.
no, I appreciate this. This has been
All right.
wonderful.
Bye bye.
All right, thank you.